She is at the 20-week ultrasound, the gel cool on her stomach, the monitor flickering between dim gray shapes she cannot quite parse. The sonographer makes a small, pleased sound. They turn the screen slightly so she can see. And there, on the display, is the image she has been waiting for half a year to see. Her baby. Curled. Small. Perfect. And tucked up to the baby's face, unmistakably, is a tiny hand. The thumb is in the mouth, the cheeks are slightly puffed, the eyes are closed, the classic image. The image that will be printed and pinned to her refrigerator door for the next 2 decades. The image that will live in her wallet, in her phone, in the first page of the baby book. And Mom, looking at it through tears she did not expect, thinks the thing every pregnant woman in this moment thinks. My baby is self-soothing already. They are going to be a thumb sucker. They are comforting themselves in there, all by themselves, in the dark. The sonographer says, gently, exactly what every sonographer says in this moment. It is so sweet. They are self-soothing. Some babies do that. Do not worry about it. Mom does not worry about it. Mom prints the photo. Mom puts it on the fridge. And for the rest of her pregnancy, every time she walks into the kitchen, she sees that same image, and she thinks the same thing. My baby comforts themselves. My baby self-soothes. My baby is doing what every parent secretly hopes their child will learn how to do, and they are doing it on their own, before anyone has even taught them how. She does what most pregnant women eventually do. She opens her phone and types the question into the search bar. Why do babies suck their thumbs in the womb? The answer she gets is always the same. A short paragraph on a hospital website, a reassuring blurb on a pregnancy forum. Babies suck their thumbs for comfort. It is a self-soothing reflex. Some grow out of it, some do not. Move on. The answer is everywhere. It is on every pregnancy app. It is in every baby book. It is what every grandmother, aunt, and friend who has been pregnant will tell her with absolute confidence. It is also, when you actually look at the research, almost entirely wrong. And the real reason her baby is sucking their thumb on that ultrasound screen is so different, so much more interesting, and so much more revealing about who that small person on the fridge is going to become, that it ought to be on the back of every ultrasound photo printed in the country. But here is what nobody tells her. Comfort is the answer doctors give when they do not have time to explain what is really going on. And the real answer overturns everything she thought she knew about that photo on her fridge. The baby in that picture is not comforting themselves. The baby in that picture is doing 3 things at once, and not one of them is about emotional self-soothing. The truth, when she finally hears it, will make her look at the photo differently every single time she walks past it for the rest of her life. For most of medical history, fetal thumbsucking was understood as a comfort behavior. The assumption was that the fetus, like a stressed adult or an anxious child, was experiencing some kind of discomfort and using the thumb to settle themselves. Pediatricians extended the same logic to infant thumbsucking, and from there to toddler thumbsucking, and from there to the broader cultural concern about thumbsucking that has shaped how parents talk to their children about it for at least 100 years. The story was simple, intuitive, and emotionally satisfying. Babies, the story said, suck their thumbs because life inside the womb is stressful, and the thumb is a comfort. The story was also based on almost no actual research, because for most of the 20th century, there was no way to look inside the womb in any detail at all. The thumb-sucking framing was a reasonable guess made in the absence of data, and like many reasonable guesses made in the absence of data, it hardened into folk wisdom long before anyone was in a position to test it. By the time researchers finally developed the imaging technology that would let them watch a fetus thumbsuck in real time, frame by frame, across the full term of pregnancy, the comfort theory had already been repeated in baby books and pregnancy magazines for generations. The reassurance had outpaced the evidence by decades. That changed in the 1990s and early 2000s, when Dr. Peter Hepper and his colleagues at Queen's University Belfast began publishing a series of careful studies on fetal behavior. Hepper is a developmental psychobiologist who has spent his career studying what fetuses actually do during pregnancy, and his lab used ultrasound to systematically observe fetal hand and mouth activity across thousands of pregnancies. What he found rewrote the textbook understanding of thumbsucking. The behavior, his lab demonstrated, is not primarily about comfort at all. It is about 3 things happening simultaneously, none of which are emotional. The first is hand-mouth coordination, which is one of the most complex motor skills the human brain ever has to develop. Bringing a hand precisely to the mouth requires the coordination of dozens of muscles in the shoulder, arm, wrist, and fingers, and it has to happen smoothly, repeatedly, and accurately. The fetus rehearses this skill thousands of times before birth, because the very first thing they will need to do as a newborn is bring their mother's nipple to their mouth, and bring their own hand to their mouth, and eventually bring a spoon and a fork and a cup and a pen and a toothbrush and every other tool of human life to that same spot. The second function is the practice of suckling itself, which is a complex, coordinated motion of the lips, tongue, palate, and jaw that the baby will need from the very first minutes after birth in order to feed. Without practice, the suckling motion is too clumsy to extract milk efficiently. With practice, by the time the baby is born, they can latch and feed within hours. The third function is taste exploration. The fetus has functional taste buds by the second trimester, and the thumb, having been bathed in amniotic fluid, carries the chemical signature of the mother's recent diet. Every time the baby sucks their thumb, they are sampling the flavor of their own environment, and through it, the flavor of the world outside. 3 motor and sensory rehearsals happening at once, all of them serving the most critical first days of life on the outside, and none of them about comfort in any emotional sense at all. Hepper's work was not isolated. Over the years, other research groups have confirmed and extended his findings. Studies of premature infants in neonatal units have shown that babies who were observed thumb-sucking on prenatal ultrasound have measurably better feeding outcomes in the first weeks of life, latching faster and feeding more efficiently than otherwise similar babies who did not show the behavior in utero. Studies of fetal arm movement have shown that the precision of hand-mouth coordination steadily improves across the second and third trimester, with the trajectory of accuracy closely matching the rate at which the relevant motor circuits are myelinating in the developing brain. The behavior is not just emotionally meaningless. The behavior is a measurable, trackable, biologically essential piece of skill acquisition that begins long before birth and continues, in slightly different forms, for the first months of postnatal life. Pediatric researchers now describe thumb sucking as one of the earliest visible markers of normal motor development, and its absence in late pregnancy can sometimes be a cue that providers monitor more closely. What looked, on the ultrasound, like a sweet little gesture of self-comfort, turns out to be one of the most important developmental milestones a human ever quietly passes. The reframe lands harder than mom expects. The baby in the photo on the fridge is not anxious. The baby in the photo on the fridge is not stressed. The baby in the photo on the fridge is working. They are apprenticed to one of the most ancient skills the human body knows, and they are rehearsing it with the patience and focus of someone preparing for the most important performance of their life. Because they are. The first feeding after birth, the one that will hand them their first meal, their first signal that the world outside the womb is willing to keep them alive, depends entirely on the rehearsal happening in that photograph. The hand-mouth movement that the photograph captures is the foundation of every act of self-feeding the baby will ever perform. The suckling motion is the foundation of every meal for the first several months of life. And the taste exploration is the foundation of the lifelong relationship with food that will start the moment they exit her body. The photograph on the fridge is not sentimental, even though every mother experiences it as sentimental. The photograph is documentary. It is a picture of an apprentice mid-lesson, and the lesson is how to be a person in a body. And the textbook is amniotic fluid, and the teacher is the baby's own brain, working in silence inside a body that is currently her own. She will look at the photograph differently for the rest of her life once she knows this. Most mothers do. And Hepper's lab uncovered something even more remarkable, something that elevates the photograph from documentary into something almost prophetic. Across his research, Hepper found that the thumb a fetus chooses to suck, left or right, predicts their adult-handedness with stunning accuracy. In a now famous longitudinal study, his team tracked fetuses who showed a clear preference for one thumb during late pregnancy and followed them into childhood and adulthood. The fetuses who consistently sucked their right thumb became right-handed adults at rates above 90%. The fetuses who consistently sucked their left thumb became left-handed or mixed-handed adults at rates far higher than the general population. The thumb preference, established as early as 15 weeks of pregnancy, was effectively a forecast of the entire neurological identity that the baby would carry for the rest of their life. The brain was already lateralizing. The hemispheric specialization that would later determine which hand the baby threw with, wrote with, swung a bat with, played a violin with, was already being set up in those quiet hours of thumb sucking on the ultrasound monitor. The photograph on the fridge is not just a picture of an apprentice. It is the first available portrait of the baby's neurological self. The hand that is in the mouth is, in some real sense, the hand that will define the next 80 years of motion in this human being's life. The handwriting on the first homework assignment, the hand on the first steering wheel, the hand that signs the first job offer, the hand that holds the hand of the person they will eventually marry. All of it is being announced, in advance, in that one ordinary ultrasound moment. She is looking at a baby. She is also looking at a forecast. And one careful note matters here, because the science of fetal thumb-sucking can be misinterpreted in unhelpful ways. The presence or absence of visible thumb-sucking on an ultrasound is not a sign of anything in particular about the baby's health or temperament. Some fetuses thumb-suck constantly. Others rarely do, or simply happen to not be doing it during the few minutes the ultrasound is running. Either pattern is normal. The same holds for thumb-sucking after birth. Most thumb-sucking in infancy is completely benign and resolves on its own, often before school age. There is no need to actively suppress it, and pediatric guidance has shifted significantly in recent decades to be more relaxed about thumb-sucking than older generations were taught. The only places where a provider may want to weigh in are if persistent thumb-sucking continues past a certain age and begins to affect dental development, or if it is clearly linked to specific anxiety patterns in an older child. For a pregnant woman watching her baby on an ultrasound, none of these concerns apply. The thumb-sucking is rehearsal. The rehearsal is normal. The rehearsal is, in fact, exactly what a healthy fetus is supposed to be doing. So the next time mom walks past her fridge and sees the ultrasound photo, the tiny hand tucked up to the tiny face, the thumb in the mouth, the eyes closed, she should know exactly what she is looking at. Not comfort, not anxiety, not self-soothing. The first portrait of her baby learning how to be a person in a body. The first visible rehearsal of the hand-mouth motion that will define so much of her child's life. The first practice run of the feeding skills that will sustain them through the entire first year of life. The first taste lesson, sampled from a fluid that carries the flavor of every meal mom has eaten, and the first available forecast of which hand will become her child's dominant hand for the rest of their life. The photograph on the fridge is not a picture of a baby who is trying to feel better. The photograph is the most ambitious self-portrait in the human life. A small person, in the only world they have ever known, getting ready to enter the next one with the only tools they have available. If this video gave you a new way to look at the ultrasound photos you have probably been carrying around for months, take a moment to like and subscribe, because we go deep on the science that makes pregnancy real. Most pregnancy channels are too rushed to tell you what is actually happening inside your body. We are not. Leave a comment telling us about the ultrasound photo on your fridge, and which thumb your baby was sucking, and whether you think they are going to be a lefty or a righty. We read every one of these comments, because every photo has a story, and every story has a real person on the other side of it, growing into someone we cannot wait to meet. Take care of yourself this week. We will see you in the next one.